What's the hype around hypertension? Welcome to our presentation where we will discuss how to manage and prevent high blood pressure for adults 40 and older. When was the last time you had your blood pressure checked? Hypertension, also known as high blood pressure, can be defined as when the force of your blood pushing against the walls of your blood vessels is consistently too high. In turn, the heart has to work much harder to pump blood and oxygen into your organs. According to the CDC, adults aged 40 to 59 have a 33.2% chance of having high blood pressure, and adults aged 60 and older have a 63.1% chance of having high blood pressure. Throughout this presentation, we will show you how to prevent hypertension in adulthood, along with how to treat pre-existing hypertension to prevent the onset of additional diseases.
According to the CDC, the main contributing risk factors for hypertension include family history of hypertension or heart disease, comorbidities like diabetes, obesity, race, age, behavioral factors like an unhealthy diet, physical inactivity, and tobacco use. Statistically, high blood pressure is more prevalent in Black adults compared to white, Hispanic, and Asian adults. There are also environmental factors that can contribute to one's risk of developing high blood pressure, such as air pollution. As we mentioned earlier, the risk of developing high blood pressure increases exponentially with age in adults 40 and over. Furthermore, approximately 20% of U.S. adults who have high blood pressure do not know that they have it. Do you identify with any of the characteristics mentioned above? Pause the video and reflect on each of these risk factors and the role they play in your life. If you identified with any of the characteristics we just mentioned, reach out to your primary care provider or local pharmacy to identify your specific steps to receive a screening. Screening is the process of getting your blood pressure measured to see if you have or are at risk for hypertension. A blood pressure screening measures the pressure in the body's arteries as the heart pumps. Some very important ways you can work to prevent hypertension are diet and exercise. Aerobic exercise such as running, walking, or cycling can help make your heart stronger and prevent high blood pressure from occurring. Practicing a healthy diet can also help you further prevent high blood pressure from occurring. It is important to eat a balanced diet with lots of grains, vegetables, low-fat dairy products, and more. Perhaps one of the most important parts about preventing hypertension is tracking your sodium intake. Most Americans consume too much sodium, so even reducing your sodium intake a little can have a huge impact on your heart health and blood pressure. You might be wondering, what are some of the adverse effects of hypertension? The biggest adverse effect is heart disease. High blood pressure makes your arteries less elastic and hardens them over time. This creates strain and wear on your arteries and heart because the heart muscles stretch to accommodate for more blood due to reduced blood pumping. In turn, this weakens the heart muscles and blood flow to the heart and can result in heart failure or heart disease. Additionally, high blood pressure can cause your arteries to become blocked. This can lead to a stroke, in which the arteries sending oxygen to the brain are blocked. High blood pressure can also lead to a heart attack, in which the arteries sending oxygen through the heart are blocked. Some symptoms of high blood pressure to be aware of are chest tightness, shortness of breath while exercising, irregular pulse, swelling in ankles or feet, increased urination during the night, and heartburn.
Have you ever seen or used the device in this image? Measuring blood pressure is done with a device called a sphygmomanometer or blood pressure cuff. Your blood pressure can be measured manually or electronically. The image here is an electronic blood pressure cuff. To measure blood pressure, a cuff is wrapped around your upper arm and inflated with air. This temporarily stops the flow of blood through the artery. The pressure is then released. The measurement involves two numbers, systolic pressure, or the top number, and diastolic pressure, or the bottom number. Systolic pressure measures the pressures in your arteries when your heart beats, while diastolic pressure measures the pressure in your arteries while your heart is at rest between beats. The entire process usually takes less than a minute and can be repeated 2 to 3 times to ensure accuracy. This infographic shows us some important guidelines to follow when measuring your own blood pressure at home. It is important to make sure that it has been 30 minutes since you have eaten, drank caffeine like coffee, exercised, or smoked. Make sure to use the restroom before sitting down as well. If you're currently taking blood pressure medication, please be sure to make sure you take your medication after measuring your blood pressure. You should sit for 5 minutes before measuring as well.
We are going to take 2 blood pressure readings 1 minute apart. Sit in a comfortable chair with back support. Ideally, sit for 5 minutes before testing. Make sure your legs are uncrossed and flat on the floor. Place your arm on a surface aligned with your heart and make sure your palm is facing up. Place the cuff right above the elbow directly onto the skin. Make sure the cuff fits your arm and does not fall down your arm. Press start on the blood pressure monitor. Try to sit as still as possible while the cuff squeezes your arm as it inflates with air. Do not talk or do anything else while measuring your blood pressure. You can see the systolic is on the top, the diastolic is in the middle, and the pulse is on the bottom. Wait 1 minute before taking the second measurement. Reset the monitor. For this machine, you press the Start/Stop button to reset. Measure your blood pressure for a second time by pressing Start. Write down or track the results.
To see what range your blood pressure is in, refer to this infographic. In the green, the normal range for your systolic blood pressure is less than 120 millimeters of mercury. The normal range for your diastolic blood pressure is less than 80 millimeters of mercury. Ideally, you should aim for your systolic blood pressure to be less than 129 millimeters of mercury and your diastolic blood pressure to be less than 80 millimeters of mercury. Any result above these ranges could be considered high blood pressure and should be mentioned to your doctor. Some blood pressure monitors allow you to keep track of your data and will show colors to indicate an elevated result. It is important to note that blood pressure can fluctuate throughout the day, and a single high reading does not necessarily mean you have high blood pressure. If your blood pressure is consistently high, your healthcare provider may recommend treatment options, which we will mention later in this video. The big question at the end of the day is, how much is all of this going to cost? Luckily, there are numerous free options to choose from to get your blood pressure checked. Oftentimes, your local primary care physician office, local pharmacy, and other big box stores such as Walmart or Target have free annual screenings with physical examinations. Here are the common price ranges of a blood pressure cuff at Walmart, Amazon, and Target. Additionally, home blood pressure monitors are covered by some insurance plans like Blue Cross Blue Shield.
Now that we have covered prevention methods and shown you how to get screened for blood pressure, we can examine some of the different treatment methods for hypertension. Some of the most common methods of treatment for individuals with high blood pressure include exercise, diet, and medication. All 3 of these treatment methods can work together in reducing high blood pressure. According to the Mayo Clinic, exercising for at least 30 minutes a day can lower your blood pressure from around 5 to 8 millimeters of mercury. Additionally, eating a healthy diet can lower your blood pressure up to 11 millimeters of mercury. The DASH diet stands for Dietary Approaches to Stop Hypertension. DASH diet includes foods that are rich in potassium, calcium, and magnesium. Studies show that if practiced correctly, the DASH diet can lower your blood pressure levels in as little as 2 weeks. One of the most important treatment methods we want to highlight is the use of medication. Adults suffering with hypertension may need different types of medication based on their overall health, but some of the most common medications used to treat high blood pressure include water pills, ACE inhibitors, and calcium channel blockers. It is important to talk with your doctor to figure out the best medication for you. Also, we would like to highlight the importance of journaling and self-monitoring hypertension. Taking your blood pressure regularly at home and staying on top of your medications is key to reducing high blood pressure and overall improving your health. Additionally, it is important to be your own advocate. When speaking to a doctor, make sure your concerns are heard and validated. Everyone deserves to have access to all treatment methods for high blood pressure, so make sure you are receiving the proper care and resources that you need.
To conclude, adults over age 40 are at an increased risk of developing high blood pressure, which left untreated can lead to cardiac disease and stroke. High blood pressure is preventable and treatable, and taking action early is best. Throughout the video, we mentioned the important risk factors, prevention of hypertension, adverse effects, measuring blood pressure, pricing, and treatment. We also provided resources that are helpful in understanding, preventing, and managing high blood pressure at home. We hope that you have learned some useful information throughout this presentation, and we thank you for listening. Please scan this QR code for other helpful resources regarding hypertension, including information from the CDC and the infographics discussed in this presentation.